This project was actually something that started before I onboarded as the Women's Health Services Director. It's been a vision of ours ever since we built Russ Tower. When we realized that this was actually going to happen, quite naturally, the first thing that we wanted to do was get staff involved. It's important to make sure that the outline of the area reflected the daily workflow of the staff. So we reached out to certain clinical individuals in different areas, such as our NICU, specialty care, nursery area, our labor and delivery nurses, as well as some of our nurses who work only postpartum. We put them at the table, but working with our architectural group, they also developed a Pinterest board for our staff to go and find designs that reflected the workflow that they wanted. That input and those who actually sat at the table with the architectural group, this is what we have now, this beautiful unit. Upon entering our unit, one of the first things that you're going to see is that beautiful picture of the Lumber River. Immediately to the right of that area is our family waiting room, which is normally where we request family members to wait while we check our patients in. Confidentiality is utmost important to us, so we want them to have a comfortable area while we get their loved one checked in and gather all the pertinent information that we need to be able to provide safe care. Then, based upon what they're presenting to the unit for, we have a triage area. We bring the patients to our triage area. It's 4 bays. In our triage area, those rooms can be utilized to also deliver should we have a precipitous delivery or someone who's coming up in labor and ready to deliver. Those rooms also are outfitted with our nitrous oxide, which is a form of anesthesia to help those women who desire a natural childbirth. So based upon their status, if we confirm they are in labor, they will go to one of our LDRP rooms. We have an isolation room. Also, we have 2 rooms that are outfitted with tubs for those moms. So if they choose to labor in that tub, which normally provides comfort for them, they have that ability. We have easy access around that tub to be able to get that mom out should she progress to the point where she's ready to labor. All those rooms are also outfitted with nitrous oxide as well. If that mom, unfortunately, is not able to deliver vaginally, we have a wonderful state-of-the-art operating room that is outfitted with guided imagery for those women to help also decrease their anxiety. We can display whatever image they would like for us, whether it's other kids at home or a family picture that's their focal point. We can place that on that screen to help relieve them of their fears, hopefully. Adjacent to that is our special care nursery or NICU. So that team is in close proximity to be able to resuscitate and recover if we need to and transfer those babies to that setting. We have in that area a isolation room for those babies who are on isolation, and we also have an area for parents to be able to room in should they need. We know that bonding time is important even for those NICU babies. So in designing our rooms, we wanted to make sure that capacity was not an issue for us. The staff took great detail to make sure that our rooms are multi-purpose. So not only can we triage you in a room, but we can deliver you in that room as well, especially for those women who come in precipitous labor. If we are a high census and we need to roll over to the postpartum area, we have the ability to deliver you in one of the postpartum rooms. So capacity should not be an issue for us. We've taken great detail in every aspect of design.
I think the thing I'm most proud about is the fact that this is a state-of-the-art facility dedicated and built for the women of our community and for Robeson County, and it's here to serve the women and infants. First of all, this is a state-of-the-art facility for them. The 3 days that they're here or so, it'll be a home. We have facilities for both guests and the patients. And I think that the efficiencies that we gain from having this new facility really will translate into better care, more efficiencies for them as well as our staff. We're very fortunate. In a rural community, you have to be able to provide the care to the patients where they live. And we're able to do that here because we have, in addition to the OBGYNs that are all board certified, we have a complementary midwife service that is the largest for this size hospital in the state of North Carolina. We use them, they work with us hand in hand with patient care. They are given a little more responsibility than the average midwife in our state, but it's all under the watchful eye of the OB on call at the time. And they have done a tremendous job, as I can witness with the fact that our C-section rates are as low as any place in the state.
As a nurse midwife at this facility, I think we have many opportunities for new patients. One of the main things is that we have LDRPs now. And that room is where you labor, you deliver, and you recover, and the mom stays there throughout her entire stay. I think that is a plus. It decreases her anxiety, promotes bonding, so I think that's also a plus.
As a labor and delivery nurse, I feel the greatest perspective of the new unit is the mother's choices in her labor experience and the comfort of her support system. She also has the choice to participate in her newborn's bathing care. We have new sinks in our rooms that provide the space to give babies their baths right with their parents. And it's a great teaching opportunity to teach the parents how to bathe their babies.
I think they're going to love this unit. It's a significant improvement over what we've had in the past. We're able to provide all kinds of care to this women. It's all been thought out. We're able to do the high risk down to 32 weeks, which no other hospitals in our current area are able to do, and in a way that provides them time to bond with their babies, encouraging breastfeeding when we can, and providing the kind of stay that I think they're looking forward to.